All right. I'm going to jump in and start talking about a few things. Then we're going to get right into labeling to kind of give you an idea of what we're going to be discussing, all right, for lab. So we're going to start off by talking about a couple common properties that all living organisms have, all right? And so it's one of those things in which I want you to really kind of keep in mind as we go through this right now, this material, you can see it again on a lecture test, but you can also see it on a lab test, because the lab tests, about 80% of the lab tests are going to be straight up identification. I'm going to put a picture of like the heart up there, and you're going to write heart, okay? But then I might have a question on there that's a true or false question, okay? So these tests are completely randomized. You're not going to take the same test that the person that's going to be sitting next to you in class would be taking, right? They come from the same material. It's a pool of questions, right? But you won't have the same exact test, okay? Your number 5 might be different to the other person's number 5. Will they be multiple choice or fill in the blank? For identification, it's fill in the blank, okay? Spelling does count, all right? So we take lab tests in the class. No, everything's on honor lock. All right, as of right now, unfortunately, we've got to do the honor lock, okay, for this. Which is, I say it's good because now I don't have to take a class time to give the test, so I have more time to teach, all right, because this is a lot of material. But at the same time, sometimes honor lock can be really frustrating for some folks. I can't encourage you enough. When you're taking honor lock, you need to be in an area that has awesome Wi-Fi. It can't be spotty. It can't be just in it, so-so. You have 2 days to take this test. If you go to a place to take the test and it's garbage Wi-Fi and you decide to take it at 9 p.m. on the night that it's due and you have problems, and there's issues and you end up not finishing the test, it's going to be very difficult for me to give you any sympathy because you waited to the last minute. Make sure when you take your practice test, right, that you go to a place that you plan on taking your test and see how it works. You need strong Wi-Fi, all right? Don't wait, all right? Can't stress that enough. And there's going to be people that are going to do it, but I'm going to keep trying to get you not to do it, all right? I hate having people fail tests because of that. All right, so let's talk about organisms here, okay? All organisms are going to display some level of responsiveness, all right? And that's going to be because a certain stimuli is going to occur, all right? And that organism is going to sense that stimuli and then react to it. And the reaction, I'm confused with the lab atlas. Where is the material you are showing? Well, this is not in the lab atlas, okay? This is still material from the textbook. All right, we're going to get out the lab atlas here in a few moments, okay? I was going to do the lab atlas stuff, but then I decided, no, let me just do a little bit of lecturing here, all right? The next, yep, you got it. The next property is regulation, okay? And this is where homeostasis kind of went. No worries. Again, recorded. So because they're recorded, you can always come back once you get your lab atlas, watch the recording, and you can label everything, okay? Also, just to let you know before I forget, all right, and then after this, I promise you I'll get to teaching here. One of the things I do want to show you too, one of the many, come on. All right, here. I used to be really slow at this, but I've gotten faster. All right, if you go to course content here, and you go down into any of these chapters, okay? All right, down here in the supplemental and below, you'll have instructional lab videos, okay? So you can watch one of these videos here on YouTube. All right?
Welcome to Biotech 10, Chapter 1,
Okay, and these YouTube videos have a lot of the labeling that you're going to utilize here. Okay, we're going to go over some of this stuff today. Okay, but you see, all right, let me stop that. So, in addition to my videos that I'll have, you also have these videos, okay, all located here under course content. Okay, you just go to the chapter or any of the chapters here, click on it, scroll down. We've already seen assignments and activities, but look, we got instructional lab videos, supplemental lecture videos, all right, and then you also have our supplemental folder here for lab and lecture. You have practice tests, okay, so there's lots of resources there for you. If anything, people probably would complain because there's too much and it can be confusing. So just kind of dip your toes in a little bit just to see. All right. So when we're talking about regulation, yes, we're talking about homeostasis. All right. Our ability, the body's ability to actually maintain, all right, that balance, that consistent internal environment. And that's based on body structure, which is anatomy, just put an A there, and function, which is physiology. So basically, our homeostasis, its ability to maintain body anatomy and body physiology, okay? And this is how we're able to regulate and make those necessary adjustments internally, right, when things inside the body start to change or things outside the body start to change. When you walk in from a hot summer day into a 65-degree room, all right, you're going to have certain regulations and adaptations and changes in some of your body systems. And just like anything, all living things want to procreate. We want to reproduce, all right? So our cells, all right, when we create new cells, those cells need to grow. And over time, they might get damaged, all right, so we need to repair them. And in order to proliferate the cell longevity or the cell life, there's going to be certain functions that cells must undergo for regular cellular maintenance there, okay? All right, we've already seen this slide here, so I'm going to kind of skip that. We already talked about the organismal organizational chart, but you can see this is in your textbook here. So in this semester, we're going to start here in chapter 2, and then in chapter 4 and 5, all right, we're going to check out all these other structures. So chapter 2 is going to be molecules and atoms and macromolecules. Chapter 4 will get into the internal cell structures, all right, the organelles inside, and then the actual cells themselves. And then when we get to chapter 5, which is tissues, we'll talk about the varying tissues. All right? So you can see as we move up in size, we also move up in complexity. Okay? All right. Skip that. Let's start off by talking about the anatomical position. This is a very important, we'll go over here in a second here. All right? But it is a position of reference. So when I say the anatomical position, all right, if you hear me say, oh, anatomical left or anatomical right, all right, that's what we're referring to as the anatomical position. And you can't see me right now, and I can't really do it because I can't move the camera. But I'm going to show you this picture right here. Okay, these people in this picture that are facing us are in the anatomical position. All right, so all these folks here are all in the anatomical position. They're standing facing us, feet flat on the ground, toes pointing forward, arms to the sides with the palms facing forward, and the person is looking straight ahead. That is the anatomical position. So when we're looking at this person here, okay, so when we're looking at this person, all right, our right is this person's left, and our left is this person's right. Okay, so imagine this person having a conversation with you. Okay, So when you're looking at this person having a conversation with them, if you raise your right hand, all right, it will be on this person's left side. Okay, so when I say anatomical left and anatomical right, I'm always referring to whatever structure or item that we're looking at. Okay, keep that in mind, please. All right, let's zip back down to anatomical position. Okay, so anatomical position includes an upright stance, feet flat on the floor, toes facing forward. All right, your arms and hands are at the side. The palms are facing anteriorly. That means toward the front. Anterior is an anatomical term for front. Head is level, meaning you're looking straight ahead. You're not looking down. You're not looking up. Okay. All right, and I'll show you pictures. So in a moment, we're going to go over the different planes here, all right, the anatomical planes. All right, but keep in mind when we talk about sections, those are like a cut or a slice. And usually when you take a cut or a slice out of something, all right, you're going to look at what's on the inside. Okay, so we're going to be referring to these slices as sections or planes. Okay, and so when we're talking about a plane, it's going to be an imaginary surface, and it's usually going to be flat. All right, that's going to pass through our bodies. So the first plane, all right, is the coronal or frontal plane. And this is the plane that's going to divide us into front and back, or anterior and posterior parts. Okay, so when we look at this picture here, okay, this bluish plane here, or purple, that's the coronal plane. And you can see it's slicing this lady into anterior to a front, and then the posterior back here. Okay, that's the coronal plane. All right, the second plane is the transverse or cross-sectional. And this is the plane that's going to divide the body into a superior, which is the top, or the inferior, which is the bottom. So this is the plane that the guy that saws the woman in half uses. Okay? So that's this plane here, this orange plane. Okay, so it's going to separate the top half of your body from the bottom half, or the superior portion from the inferior portion. All right. We also have the mid-sagittal plane, all right, or median. This plane is going to go straight down the center of your body, and it's going to divide your body, most importantly, into equal left and right halves. So if we look here, you can see this green plane here. It's going down the center of our body, between the eyes, all right, right down the middle here. And that's going to be dividing this person into equal left and right halves. Okay? Another type of plane is what we call the sagittal plane. Again, it's going to cut the body down the middle, all right, but it will not be equal. There'll be unequal portions. It'll be parallel to the mid-sagittal planes, all right? But so think of a sagittal plane. It will not cut the body into equal portions. They'll be unequal. The mid-sagittal cuts the body into equal left and right halves. And then finally, the oblique plane is going to pass through the body at a specific angle. It's not pictured here, all right? And I'll try to do my best to draw a good one, all right? So the oblique plane would actually cut this woman at about 45-degree angle, okay? So it's supposed to be passing through like a slice here or here. It could be at any angle. It could be at 45, it could be at 25, whatever, okay? All right, so you can see here with our three-dimensional structure here, all right, we're showing all these different angles that we're cutting through these intestines here. And it gives us different appearances on those slides or sections there. All right, quick If you've taken med term, awesome, good for you. And I'm not saying that sarcastically, because med term is helpful, all right, because there are a lot of medical terms, anatomical terms, etc. And it used to be a prereq for this course, right? If you've taken the class, this will be pretty much review for you, okay? But when we're talking about anatomical directions, all right, we are going to use these terms, and they're specific terms, to explain relative positions, okay? So usually, and we'll talk about it in opposing pairs, like anterior and posterior. Anterior is front, all right? Posterior is back. Dorsal and ventral, everybody, well, I shouldn't say everybody, I shouldn't assume, I'm trying not to, but if you know that fin that sits on the back of a shark, that's the dorsal fin. So our dorsal portion is our back. Our belly button is on the ventral portion, that's the front. Okay, so some of these terms will be used to describe the same thing. All right, proximal and distal. Proximal is close, distal is far away. Okay, so let's take a quick look here. All right, so here you can see anterior is towards the front. Posterior is towards the back. Okay, we're looking at this guy here, going up towards the head is superior. Going down towards the floor of the feet is inferior. All right. Now, lateral medial, meaning, all right, if we start to move towards the center of our body or whatever we're using as the point of reference, all right, so if I'm going in from her shoulder towards her chest bone here, I am going medially. If I'm going from her chest bone out to her shoulder, I'm going laterally. I'm moving away. This line that's going down the middle of this lady is our midline. So I'm moving away from the midline. That's lateral. I don't like these last two. I don't think they're really good with proximal and distal, because if the arrows are pointing up, some people get confused and say that's superior, and if they're pointing down, that means distal. All right. But basically what it means is the point of reference in this example is the hand. So if we're going from the hand towards the shoulder, all right, we're moving more towards the axial skeleton, which is your head and your spine. All right, so if you're going from the hand towards the shoulder, that's proximal. If you're going from your foot, all right, think of it, you can use the heart as your point of reference. If we're going from our foot towards the heart, then we're going proximal. We're moving proximally. All right. If we're going from the shoulder out to the hand, then we're moving distally. We're moving away from the midline here. Again, I'm not a huge fan of those directional terms, or these pictures here, to be more specific. All right. You heard me talk about regional anatomy. You heard me talking about axial and appendicular. So just to kind of make it a little bit easier, because we're going to be talking about axial and appendicular when we talk about the muscles of the body, of the skeletal muscles of the body and the bones, the skeleton. All right. But the human body has two main regions. The axial region is going to be your head, your neck, and your trunk. Okay. And then the appendicular is going to be your upper and lower limb. So what does that mean? Easy way to remember it. Appendicular, think arms and legs. Axial, everything else. Head, neck, trunk. Make it easy. Okay? And then within these regions, there's subdivisions. Okay? There's, many more regions. So what I encourage students to do is to go to figure 1.7a. This is in chapter 1, and learn these terms. Okay? Look at them, because I'm going to tell you this right now. This slide here, on your first lab test, you are going to have anywhere from 2 to 4 questions on these 2 slides. Guaranteed. Guarantee it. And I should know, because I grade the tests. Okay? So make a note. I'm not going to go over these. You guys can do that on your own. This is pure memorization. All right? Make flashcards. I don't care. Okay? But you need to know this. All right. So these are the regional terms. This will go over a lot. So there'll be on the test, it'll have a line pointing to an area here. All right. And it'll ask you, all right, what is that? And you'll say that's the pectoral region. Okay. So memorize both of these. Easier said than done, I know, but still. Well, all the pictures in the slides and textbooks match the pictures. Most of them. I can't guarantee you, but I will say close to 90%. And on some tests, it'll be close to 100%. Okay, there's going to be a few that you probably have not seen. That's always the case. Okay. All right. Let me check something here. Nope. I'm going to stop here for this part. I want to start labeling. All right, this is a good place to stop. Body cavities and membranes can be somewhat confusing, so I will work on that with you folks on Thursday. Okay. So let's not skip, but let's stop this. Make a note to myself. Okay, and then we'll come back to that. All right, but let's do some labeling here because we got a lot of stuff to label. All right, this is not in your book, okay? This is not in the atlas. We'll get to the stuff here in the atlas. I just want to show you some of the pictures. You need to be able to recognize this, okay? There's the anatomical position here. I'm going to show you a couple other different types of anatomical positionings, I should say. All right. So anatomical facing us. Now, when this person is laying on their front, that's the prone position. When you're doing a push-up, you are in the prone position. Okay. All right. When you're lying in your bed at night, oh, come on now. When you're lying in your bed at night, looking up at the ceiling, all right, you are in the supine position. And a way that I remember that is laying on your spine, feeling fine in the supine position. Whatever works, right? All right, this is the coronal and frontal plane. Okay, and you can see this plane is cutting this person into anterior, frontal, or posterior back portions there. Okay. Here's your transverse or cross-sectional plane. It's this blue plane right here, cutting this person into superior and inferior halves. All right, mid-sagittal. Mid-sagittal is down the center. It's going to divide our person into equal left and right halves. And here's an example of the sagittal plane. You can see now we've moved over the plane just a little bit towards this person's right side, and there's more of the left side compared to the right side, okay? Or the left half and the right half, they're unequal. All right, that's a sagittal plane. All right, and then here's the oblique plane. It cuts through at an angle. All right. And so this picture here is just showing you all the different angles there. All right. Let's jump on in to the labeling portion here, okay? Yes, it's sold in the bookstore, although, you know what, I don't think they sell it on Amazon, but you can look. I can't speak for that, but I'm almost positive the only place you can get it is at the bookstore. But who knows, Amazon's got everything. Oh, is it? That's good to know. I remember when Amazon, don't worry about it. Trust me, when you go back and label this stuff, you'll be fine. I know it. You'll feel bad. You'll feel naked right now, but you'll be fine once you go home and label all this stuff. I remember when Amazon just sold books. All right, here's the thyroid cartilage. It's a blue structure here. All right, so I'm going to help you out with some hints on how to identify certain things. If you see a tube-like structure and it's red, it's an artery. If you see a, excuse me, you just lost sound, it might come back. Well, they can't hear me anyways. If it is a blue tube structure, it's a vein. Okay? If you see, so keep in mind, colors will help. The cartilage, all right, color for the thyroid cartilage is like a light blue here, okay, because it's made of hyaline cartilage. You'll learn about that later on. So if we go just below the thyroid cartilage, often in men it's referred to as the Adam's apple because men's thyroid cartilage is more prominent, okay? Just inferior to that is the thyroid gland. You look at the thyroid gland, it looks kind of tan, orange, I don't know what color, but it's got all these blood vessels on it. Don't confuse the two. Okay, that's the thyroid gland there. All right, dropping down to this slide, you can see the trachea. Don't call it the windpipe. Okay, but this is right here is the trachea. These little blue structures are called C-rings. And they're made of cartilage. You don't need to know that for this class. You'll learn it in 211. Okay? Then the trachea divides and it splits off. Okay? The division here on our left side is known as the right primary bronchus. You need to put down right, anatomically right. This is facing us. This is the front. Okay, so across from that is the left primary bronchus. So after the split of the trachea, we have our primary bronchi. We have a left and a right. All right, that's all for right now. You'll go in much more detail into 11. Okay, so the right primary bronchus will eventually, right, lead us into the right lung. So again, you can tell on this model here, all right, this model's anatomical left, this is its anatomical right because it's facing us. All right, then across from the right lung is the left lung. All right, so like maybe some of you or most of you on our break, I started eating something, and as I was eating something and swallowing it, it had to travel through my esophagus before it got to my stomach. The esophagus is the tube that is going to connect your pharynx or your throat, all right, to your stomach. So you can see it here in this model. Look at the color of the esophagus. It's not red. It's not blue. Okay? It's not carrying blood. So when you see it here, you see to the right of to our right, to the anatomical left of this person, you'll see a red tube. That's the aorta. Okay? So pay attention to the colors. The esophagus is like a tan color. All right, so don't put a blood vessel down. It's not the aorta. Okay, but the esophagus sits right behind the heart. We've cut the heart out. It's not here. Now let me put the heart in. Now you can't see the esophagus because the heart's there. Okay, the heart sits in between the lungs. It's more to the left. Okay. So it creates this kind of indentation, this cardiac notch here into the left lung. So now you can see the heart all by itself. Okay? So in 2-level, you get to learn all these blood vessels and muscles and all that. So this is as far as we're going to go with that. So another structure that we are going to talk about is this guy, the diaphragm. This is your breathing muscle. When this muscle contracts, it sits right below the lungs. When it contracts, it allows air to flow into your lungs. Okay, the red portion here, that is skeletal muscle. This white portion, that's a tendon. Later on in the semester, we're going to get more specific with all of this. But for right now, when you see this on the test, the very first test, you will just write diaphragm. Okay? So you can see the diaphragm here in this model. Okay? So here are the lungs. Here's one lung. Here's the other lung. And then both the lungs sit right on top of the diaphragm here. And it's the diaphragm that separates your chest cavity, known as the thoracic cavity. It separates the thoracic cavity from your abdominal cavity or your abdominal pelvic cavity. Okay? So that's what separates the two. All right, we're missing a very big organ here. Okay? A lot of people think that's the largest organ in the body, but it's not. But it's the organ that you damage the heck out of when you go binge drinking on New Year's Eve. That's your liver. Excuse me. All right, now look. Some perspective here, people. This is the left, this is the right. Okay? The liver is on the right side of the body. All right? Take a good look at that picture so you know that. Okay? On the left side of the body is this structure here, which we'll label in a second, but that's the stomach. Okay? Stomach's on the left, liver's on the right. All right. Here's the liver all by itself. We're looking at the inferior surface of the liver. So we're looking up at the liver. All right, and then this next model, here's the liver just hanging out all by itself. We've dissected away a whole bunch of other stuff. But you can see it, the liver in relation, all right, to the stomach. Here's the stomach right there. And I know this because here's the esophagus emptying its stuff into the stomach. Excuse me. It's not corona, I promise you. I had a Kind bar and something got stuck in my throat. I'm sorry. Something got stuck in my pharynx. I should be using the proper anatomical term. All right, so there's the liver. Now there's a green globby thing that hangs on the liver. That's the gallbladder. And your gallbladder does not make bile, by the way. Okay? It does not. It just stores the bile. The liver makes the bile, and the gallbladder just stores it. So when you eat a fatty meal, and we've got to break down those fats, all right, your digestive system will release a hormone called CCK, cholecystokinin, which will stimulate the contraction of the gallbladder, and the gallbladder will squeeze out its bile, and it dumps it into the small intestine. All right, speaking of the digestive system, let's talk about the stomach. Okay, this is the stomach. Okay, we've cut it open. So here's the opening of the stomach, and this is the exit of the stomach. So food comes down the esophagus and goes in. Okay, so this opening is closest to the heart, so we call it the cardiac sphincter. Okay, a sphincter is a circular muscle. It's not a muscle. All right, I shouldn't say that. But when we talk later on, we'll talk about sphincter muscles. Okay, and it's a circular muscle. But this structure is not, all right, a muscle. It has muscle tissue in it. All right. So it is the entrance to the stomach, the cardiac sphincter. Okay. The exit is called the pyloric sphincter because it's closest to the small intestine, the pylorus. Okay, so this is where food will exit out. So if you notice on the interior of the stomach, it has these wrinkles. All right, it's not smooth, it's rough, like ruffles. Ruffles has ridges, so does your stomach, and we call those ridges rugae. Okay? Those ridges are called rugae, and they're all inside the stomach. All right, next, here's an overall picture of the stomach. And then you can see the inside. So that's the stomach from the outside. All right. So once stuff starts to leave the stomach here, it goes into the small intestine. And the first portion of the small intestine is called the duodenum. Some people pronounce it the duodenum or duodenum, whatever. Okay? So here's your stomach up here. Here comes the food. It's going to exit out into the duodenum. And that's this portion here, this whole structure. That's the first part of the small intestine. There's 3 sections to the small intestine. The duodenum is the first part. I'm going to show you the duodenum on another model here, okay? So there's you don't see, okay, the stomach we took out, okay? So normally the stomach would be right here. So here's the duodenum, all this. Okay? That is the duodenum. And then we're going to move into the second portion of the small intestine, and that is called the jejunum. And that's pretty much all of this area here. And then the last part of the small intestine is called the ileum. Make sure you get the spelling of this correct. There's another structure that's pronounced the same way, that's spelled I-L-I-U-M, and that's part of your hip bone. So that's why spelling is important. Okay? Don't spell that for this structure. And you can see, so here's the ileum. It's pretty much all of this over here, the last portion. Okay? All right, so above the small intestine, you have a very important organ. That's called the pancreas. That's all of this. The pancreas has a lot of different functions. Produces enzymes, produces insulin, produces glucagon. Okay? It's a gland. It's also an organ, but it's a gland. All right, I'll give you a better view here of the pancreas. Here you can see it. It's all this guy. So the pancreas sits in between, all right, the duodenum and then this structure over there, this guy, okay, that is the spleen. So the spleen is also going to be on the left side of your body. In close proximity to your stomach. All right, so you can see it here a little bit better in this model. So we cut out the stomach, because here's the esophagus. Okay, so normally the stomach would be sitting right here. And then your liver would be over here. Okay. and the pancreas, great question. Pancreas is right here in the middle. Sure. I'll show you the pancreas where, here's the spleen, here's the duodenum. So the pancreas sits below the stomach, yep, and beside the spleen or in between the spleen and the duodenum. All right, so let's move on back to the digestive system. We did the small intestine. Now we're going to begin with the large intestine. So the small, this is part of the small intestine right here. That's what they're showing you, the last part. That's the last part of the ileum. So the ileum dumps its food product here into the first part of your large intestine. All right, and that's called the cecum. Hold on one second. This big old sac right here, that's the cecum. First part of your large intestine. Okay, now we're going to bounce back and forth here in between two models. I'm going to show you the same structure but on two different models. So here you can see the cecum, okay, on this model, and now you can see it on this other model. And this other model shows you, all right, here's our small intestine all over here. All right, there's the ileum, last part, and you can see how it's going to just dump its food stuff into here. All right, so this is where we're still going to be undergoing digestion, but we're going to start to slowly form your feces, aka your poopy. Okay, so we're still digesting things, absorbing water. All right, but we're going to start to make, in the large intestine, we're going to start to create your feces. At the end of the cecum is the appendix. All right, it's that little batch of tissue hanging off of the cecum. And if you've ever had an inflamed appendix, you're very thankful to get that thing out of you. Here you can see it on this other model. All right, so after the cecum, all right, we're going to start to move our food. It's going to go on this little pathway here. And it's going to work its way around and down to where it exits your body. Okay? So that first part there past the cecum is called the ascending colon. It's going to be, we call it that because the food is going to move up here. The ascending colon is on the right side of your body. Okay, you'll be able to see it a little bit better on this model here. Here's the ascending colon. Okay, so you can see here the ascending colon is going to approach the curve. Okay, it's this curve in the large intestine. And we call that curve the hepatic flexure. So it's either called the hepatic flexure, or you can call it the right, that's RT, right colic flexure. Hepatic, because we're near the liver. We're on the same side as the liver. So you have two choices for that. You can call it the right colic flexure or the hepatic flexure. You can see it right here on this model. All right, so flexure obviously means bend or turn. And in fact, that's how we describe it if we ask you that on the test. Name this bend. All right, hepatic or right colic flexure. So then your large intestine flattens out, okay? So we refer to that section of the large intestine as the transverse colon. All right, and the transverse colon is going to span from the right side of your body and cross over to the left side of your body, only to come across another flexure here. So you can see the transverse colon in this model, okay? It's going straight across. Okay, so then the transverse colon comes across that second bend, and we refer to that second bend, all right, right here, as the splenic flexure or the left colic flexure. And I'm sure you could probably figure out why we call it the splenic flexure, because that's where the spleen is. It's on that side. Okay, so this is the left side. So splenic flexure or the left colic flexure. Let me show you on this model here. All right, so after that next bend or curve, then we come up on the descending colon, which makes sense because now we're heading back down towards the feet. The descending colon. And now we're getting closer, all right, to the end of the large intestine. So at this point, you know, we've absorbed a lot of water, we've digested a lot of the food stuff, we're still digesting things, but we're kind of making our last, lack of a better term, like last ditch effort to really start to create the formation of the feces here. Okay, so we've got our descending colon here on this model. You can see it on this model too. All right, and the descending colon then comes up onto this one area of the colon in which it starts to kind of curve one more time, but it's not going to be as sharp of a curve. Okay, and that where it starts to kind of curve back in, we call that the sigmoid colon. So you got your descending colon here, and then where it kind of curves back up and in, that's going to be the sigmoid colon. And we're pretty much coming up on the last part, all right, after the sigmoid colon here. Right, we're going to see the one of the last parts here of our digestive system. Almost done. Once I'm done with this digestive system, we'll call it a night. Okay, so you got your sigmoid colon, all right, kind of heading back towards the midline here, and it comes up to the last part, all right, which is the rectum. And this is where your feces gets stored, and it waits until you have to go to the lavatory, to the bathroom. Okay? So when your feces starts to build up in here, it puts pressure on the walls here of the rectum, and there's receptors in the walls there, and then they, of course, send information up to the control center, and it tells the control center, hey, we've got some poop here that we've got to get rid of, and then the control center interprets it and then sends its response information to the muscles here, and you go to the bathroom. Here's the rectum here. So this is a mid-sagittal cut. So this is the posterior, your backside, and this is the anterior. Here's your front, in case you were wondering. There's your spine. So the rectum on the test, we just assume the person is in the anatomical. No, don't assume that the person's in the anatomical position. All right? Because they're not always going to be in the anatomical position. It's almost a 50-50. So right here near your tailbone, down here, all right, right in front of it, that's the rectum. Rectum darn near killed him. It's an old joke. Some of you may have heard it. All right. So here you can see this is the rectum right in this area here. All right, one more picture for the rectum. Actually, no, there's two more pictures after this. So here you can see, all right, the sigmoid colon is up here. All right, down here is the rectum. All right, and you got this model here. This, in case you're wondering, we'll get to it, but this is the bladder. So here's the bladder in front. All right, right behind it is the rectum. And then finally, the last rectum slide, this one here. It's like 5 rectum slides. But of course, I want you to be able to see them all. Okay? Now, I know that these pictures jump around a lot in the book. It's just how they're organized due to the fact that we use this atlas for 210 and 211. So we tried to organize it as best we could. Just be patient. All right. And then the final 3 slides of the evening, okay, or 2 I should say. Here's one. There's the anus. That's the last part, okay? That's this area right back down here. So when you are ready to defecate and go to the bathroom, all right, the muscles inside the anus relax, and then the feces can pass right out of you or get pushed out of you, either or. And then finally, nope, I lied. There's one more after this. All right, so this is the rectum, and then right below it, this area here, that's the anus. All right, this is the last one. Boom. So I'll let you write that down. Just a reminder, you have those 3 assignments, so how will I come back to rewatch this video? I will send you a link in your email. At the conclusion of each class, each night, I can't guarantee you when I will send it out. What I mean by that is, by the time you wake up tomorrow, you will have an email link to watch these videos, okay? So I usually do it every night, but I might not do it till 10, 11, sometimes 1, 2 in the morning if I have work to do, okay? But I will send these out to you, okay? So you